Hello, everyone. Welcome to today's webinar, Planning to Reopen Your Business, the top 10 questions answered. My name is Mike Vanoy. I'm the head of marketing here. And without further ado, let's jump in. I want to introduce today's panelists, but maybe a little context first. So I know the world has changed a whole bunch in this last couple months, and this might seem like an eternity ago, but back on February 29th was the first death from the coronavirus from COVID-19 in the United States, and that happened to be up in King County, near suburb of Seattle. And so this map is actually a map of King County, and coincidentally, we have an office right there in Bellevue, right across the lake from Seattle, where coincidentally a bunch of our HR services team resides and works from. And so because, the King County was kind of ground zero for the US in the pandemic, I know the numbers spiked higher in New York and other places after, but the reason I even mentioned this is our team there was really ahead of the curve because they were fielding calls long before people, even the general public, knew what the heck this thing was and what it meant. And so if you have questions, just general questions, how to handle COVID-19 situations. We've got a couple of really good webinars that we've got recorded on the website that you can check out from this same panel. But today we want to pivot because they've been receiving, because they were ahead of the curve. They're also, dare I say, in the backside of the curve in fielding the reopening questions sooner. So whether you're still living in a shelter order or you're about to be lifted from one in the next week or two, or you're a few weeks away, I think all of us are at minimum dealing with a new reality and in different phases of reopening. Very few businesses that this is a simple light switch that you flip the switch and all of a sudden, boom, hire your people back. And even if that was the case, certainly the world has changed. And so I think there's some really important HR questions that all of us need to ask. So with us today, Mark Schultz and Nicole Young. Mark is a SHRM certified HR professional. He also has a certification as a payroll HR, a professional in HR with international accreditations. And then Nicole, attorney, and she acts as our HR compliance manager. So two people with a lot of experience in this area, tapping into all the thousands of questions that the team up in Bellevue has been responding to. So what are we going to talk about today? So on the left here, what's in? Both Nicole and Mark are going to take some specific questions. Going to start out maybe high level with a couple of obvious questions that everyone's asking. The answers may not be as obvious as you think, however. But we are going to dive into a little deeper information around wage and hour, health and safety, hiring and onboarding in time off and leave, how to handle those situations in a COVID world. Then whatever time's left, we're going to go into Q&A. What we're not covering, and there's a correlation in it, so I'll direct you to last week's recorded webinar. It's on the website on the suresoftware.com/COVID-19, the Paycheck Protection Program, PPP, forgiveness. And so we walked into great detail about how to maximize the forgiveness portion of your PPP loans. So we're not going to go into detail on that today, but just know that we have covered that topic, and there's an excellent recording out there. Also, next week, we're going to have a webinar on focusing on tax credits, employee retention credits, in the FICA deferrals that are available as provisioned in the FFCRA and CARES Acts. So with that, we're not your lawyer, we're not your CPA, we're not your bank, but we are a bunch of people who know this stuff pretty well because we live it every day. So our little safe harbor disclosure at the bottom, we just want you to know we're sharing the absolute best information we possibly can. It doesn't substitute legal advice, excuse me. But we're here to help, and we think we have a unique and I'd say very expert point of view on these topics. So with that, let's go ahead and just jump into the questions. And I think the first one, and I don't know who's going to handle this one first, Mark or Nicole, but it sounds like a stupid, obvious question. Hey, when can I reopen? But it's definitely more nuanced than that, right? So whoever wants to take this one first.
Sure, I'll go ahead. Thanks, Mike. So, when you're considering when to reopen, the things that you need to keep in mind are your physical location as well as the industry that you belong to. Um, all of the shelter-in-place orders, for the most part, are being governed by state and local law. And so, when we're reopening, we need to look to those sources to figure out when we can reopen. So what I mean by that is you're going to need to pay attention to whatever your governor, your county representative, or your mayor is saying for specific dates on when you can reopen. If there's some sort of conflict between what your governor and what your mayor is saying, you need to follow whatever is most protective to your employees, and unfortunately whatever is most restrictive to your business. So if you have a situation where the governor is saying go ahead and reopen tomorrow, and your mayor in your particular city where you're located is saying you need to wait 3 weeks, you got to follow whatever your mayor is telling you to do. This is also going to depend on your industry. We're seeing a lot of phased approaches to reopening that are industry based. The rationale being we want to open some businesses, maybe gauge numbers for coronavirus outbreaks, and slowly reopen to more and more industries that are going to be more public facing or perhaps attract more crowds. So that's sort of your general outline when you're starting to consider, okay, when do I need to reopen? Mike, next slide.
Hey, Nicole, I'm going to put you on the spot here,
Yeah.
if I can ask. So can you share with people, because there's, I mean, it's pretty much everybody in this call has been on Facebook, and so there's a pretty wide spectrum from the civil libertarians to the protect everything at all costs spectrum, right? So can you kind of give maybe a backdrop of maybe the legal basis of, why must I follow the local versus versus the state versus a federal guideline, so people can have maybe a little deeper understanding of why they need to follow the guidance you just gave them.
Sure. So there's several layers of potential exposure to liability if you do reopen. The first that I can think of is usually contained with any sort of shelter-in-place order are penalties. So for example, in Washington, there are civil and criminal penalties for not complying with the order. Civil penalties means you get fined some money. Criminal penalties mean you're fined money and potentially spend some time in prison. So besides the penalties contained within the orders themselves from our public officials, if you do reopen and let's say some employees make a complaint or they file a lawsuit because they become sick with coronavirus because they went back to their workforce, it's going to be an uphill battle to argue that you're not at fault for, and worst case scenario would be if someone passed away in your workforce due to coronavirus. So I think it's really important to follow these reopening guidelines. There's also potential issues with other governmental agencies coming after you. For example, OSHA, which is our federal agency that supports occupational safety and health. They could potentially, they audit certain businesses, and if they find that you reopened too quickly, they could potentially fine you money. So there's money at stake here, as well as, and is an extreme example, potential time incarcerated.
And it probably is obvious, but maybe just speak to a second. I presumably if a shelter order is lifted in an area, you're free and clear. Everyone around you is doing it. What is your obligation, if any, to open if you don't feel comfortable yet?
Oh, there's certainly no obligation to reopen if you don't want to yet. That is your prerogative. So if you're nervous about reopening, then that's fine. You can delay.
Very good. All right. Ready for the next one then?
Yeah, let's do it.
All right, sounds good. See if I can stump you on this next one here. All right, so what are the first steps, and maybe Mark, I think this one might go to you. So what are some of the first steps before just simply throwing the doors open?
Thanks, Mike. Yes, there's a couple of things, and really the biggest one of them all is you're going to have to create a reopening plan, which addresses there's basically 4 things that you really need to consider, and actually 5 things. The first one is, and this is the biggest one, is your health and safety in the workplace. Employers must provide a workplace that is a safe workplace. So what does that mean? That's going to depend on your industry, your location, and a lot of the things that Nicole talked about as well is what's going to be allowed, what isn't going to be allowed. So health and safety, we're going to talk a little bit more in detail about that later on in the presentation, some of the details of that. So that's the big one. Start thinking about how in the heck am I going to do this and maintain safety for everybody. And there is a lot to this. The other one, hiring and onboarding. So I've been closed for a while. What do? What are my policies? You need to contact your benefits carrier to make sure, your broker, to make sure that your benefits can continue. Do you need to re-enroll everyone? Things like that. Also, W-4s, I-9s. You need to recertify the I-9s if you've been closed. And that's Section 3, the re-verification portion. W-4s, you may need new W-4s for everyone. Wage and hour considerations. Am I going to bring back everybody at the same wage? How am I going to communicate any wage cuts? Have my jobs been significantly restructured so that the pay rates may now be different? That could open up quite a can of worms for your employees to say, wait a minute, you're bringing me back, but I'm going to be at a different lower wage? Hold on a second, let's talk about that. Time off, leaves request. There will be people who want to have more time off. There will be people who are going to request leave for various reasons. How to address all of those. Again, we're going to talk a little bit more in detail about that throughout the presentation. The reopening plan should include intensive communication plan for your returning employees. If you're going to bring everybody back at once, it's going to be completely different than if you're going to do a staggered reopening. And again, it's going to depend on your business needs, your industry, and how you do things. Next slide, please.
Forgive me, Mark.
No problem.
So I'm going to try stumping you here too. So talk us through maybe a little bit more detail on that of how much of, and I know you said a lot, so I can't go line by line, but how much of this is, say, HR best practices, just trying to have good relationships with employees who actually want to come back to work for you, and things are crystal clear to avoid issues, versus, say, legal requirements. Can you kind of parse that out a little bit?
Sure. As HR, the HR aspect is communication. Over communicating, especially something that is going to be as, how should we say, sensitive as coming back to work while we're still dealing with a pandemic, where there's all this information out there. You mentioned everybody on the webinar has probably been on Facebook at least once or twice over the last 90 days. Well, yeah, of course. There is a ton of stuff out there. Is it all legit? Is it all pertaining to your particular location, what you're doing? Maybe, maybe not. So think about what are the fears? What are the concerns? How am I going to mitigate that? And then, Nicole's going to talk a little bit more about the legal stuff as well. And there's a lot of things to consider here. What are the things that I can do? What are the things I should do? And how am I going to blend the two together? So legal, HR, communicate. What can I communicate? What should I communicate? What shouldn't I communicate? And how should I communicate it is going to be key, especially that last point. How should I communicate to my employees who are coming back, who are going to be newly hired? We're going to talk about that as well. There's a whole host of things. It needs to be, as an employer, manager, you need to start thinking about that now, as opposed to, oh, gee, I'm opening tomorrow. Gosh, how am I going to do this? So start thinking about it. Carry around a pad of paper, whatever, a napkin, whatever you have. If an idea pops in, write it down. How am I going to address bringing people back? Who do I bring back first? Hey, I'm going to bring people back to my office in whatever city. Say, for instance, around here, Kirkland versus maybe Renton, two different things. They're geographically a little bit different. So who knows? Those are the things that you, as an employer, as a manager, need to think about those things. Does that answer the question, Mike?
Yeah, it does. So what I wanted to help anybody, if in case there was the question, the guidance you're giving is really good business advice, right? This is
Absolutely.
there's a component of legal in it. You can't
Mm-hmm.
change somebody's comp plan, bring them back without any communication, without any written policy changes, et cetera. You're leaving yourself exposed. But at the end of the day, these are not necessarily requirements of the FFCRA, the Families First Corona Response Act, or the CARES Act. This isn't legislative things that you must do, but really this is just smart HR to make sure that your employees and you are on the same page and you're mitigating risk of any of the fallout from any bad communication. Am I saying that right?
Yes, that's the overall. Yes, that is true. There are some guidelines on how to do that included in the laws, for instance. And again, Nicole's going to talk a little bit more about that as we go through this. So how you actually do that, there's some things to consider. There are some liability aspects, as Nicole touched on as well. Yeah, if you don't follow the order, there's some possibility of penalties, things like that. There's some things that fall under ADA, FMLA, all these acronyms that us HR nerds like to use that you have to consider. So tying in with your HR professional, your HR department is really going to be key to this. They can help guide you through that.
Very good. Thanks, Mark. Go ahead.
I was just going to say, so in terms of best practices, it is important to communicate all the new policies that you'll be implementing, but there are a lot of legal requirements involved with reopening, and most of them pertain to ensuring health and safety for your workplace. So I can't get into a state-by-state analysis of this, but for example, here in Washington, there is a new reopening plan from the governor, and the steps that each employer needs to take in order to reopen involve a lot of health and safety requirements, which we will go over in this webinar. But generally speaking, if you're looking for guidance on a healthy and a safe way to open your workplace, I would go ahead and take a look at the CDC's guidance, OSHA's guidance, as well as any state-specific Department of Health guidance for health and safety and reopening.
Thanks, Mark. Thanks, Nicole. That's helpful. Okay, let's go on to question number 3. Speaking of health and safety, right? So what are the basic health and safety issues you should consider before reopening?
So there's a lot here. The first thing is, are you going to implement screening procedures? How will you screen for COVID-19 when either your workforce partially returns or completely returns? Are you going to do some things, and again, more details coming up on this in another aspect of this presentation. Cleaning procedures. What materials do you need? How often will you clean? Will you hire someone to clean for you? Cleaning businesses, there's a lot of them out there. Some may not be able to meet the needs of your particular facility. Where will you clean? Common areas, the kitchen, there's so many things to think about with this. It's like, how am I going to do this? What do I need to clean? Do I need to clean the door handles every hour? Do I need to clean the phones? For instance, the local Costco, when you pull up to fill up with gas, there are employees standing out there, spray bottle of sanitizer and wipes, and the moment you let go of that pump handle, guess what they're doing? They're wiping that down for you. The pin pads on the keypads, all that. Every customer, they're doing that afterwards. So things to think about. It seems like kind of a daunting task, but if you just think about, where do people go? What do they touch? What do they use? How am I going to keep this as safe as I possibly can for my employees? All right. Who's going to be? Yes, sorry.
Well, yeah, and so maybe you're going to address it, whether it's you or Nicole. So again, I want to try to parse out HR best practice guidance here. Sure. Versus legal requirement versus where do we go? So if I'm a small business owner, I've got 40, 50, 60 employees, and everything you just said to me makes sense. Yep, I need to consider all those things. Where do I go and how do I know if I did it right? Because maybe I thought I was really diligent and I'm missing some important aspect that I didn't know what I didn't know.
Again, your local health department, state health department, CDC, OSHA, all have got some really, really good resources for that. And I've seen a couple that are industry specific. For instance, manufacturing versus an office environment. So there's a lot there. And again, general guidance, start with your public resources first. And then again, okay, how am I going to apply that to here? Exposure risk plan. What happens if you get recontaminated? What if you have a suspected or confirmed case of COVID? Oh, there's some really bad feedback there. There we go. Okay. Um, Social distancing requirements. Can you rearrange your workplace? That's part of the guidance. Are you going to have one-way streets, so to speak, in your workplace? You can only walk down this aisleway this way and come back the other way. Yeah, so there's a ton of different things there. What do you need? Are you going to require people to wear masks, PPE, gloves, whatever the case may be? A training plan for your managers and employees. That's going to be key. Hey, folks, this is what we need to do. Wash your hands, wear your masks, whatever the case, all that stuff. It's a really good idea to designate a COVID-19 workplace coordinator responsible for issues that arise in the workplace. And that employee is going to be critical to your success in your reopening, and it needs to be that person needs to be chosen carefully, because they're going to see what's happening. They're going to see what people are doing, and you may have the best plan in place, and part of that may go out the window because what you thought would happen may not be may not be able to follow all those things. So you may need to adjust your plan once you do reopen. Nicole, do you have any other comments regarding that?
In terms of your legal requirements for reopening, you're going to find all the information you need within your particular the official who releases your reopening plan. So whether that be your governor or your mayor, they're going to say, when we enter phase blank, these types of businesses can open under these conditions. And the conditions involved are typically a ton of health and safety requirements. And what I've seen is that a lot of times the reopening plan will say, employers who can reopen must follow guidelines found in whether it's OSHA, some other public health authority. So even if there is an authority such as OSHA that's saying these are guidelines for reopening, if within your reopening order it says that it is a requirement to follow the guidelines, you should no longer take them as guidelines. You need to take them as mandatory.
So, hey, Nicole, so what obligate? I think I know the answer to this, but I'll ask it anyway. So what obligation does the employer have for communicating and training these guidelines or regulations provided by, say, the mayor, right? Versus, hey, I assumed we all watch the news and my employees knew the rules.
Yeah. So I have seen some explicit requirements.
True, right? Maybe they do, but there's still legal, culpability here.
Sure, and sometimes it's explicitly within the reopening order itself. It says you must educate your employees on what coronavirus is, the symptoms, how to reduce the spread, and sometimes it's sort of implicit where the rule is you must maintain social distancing. And what's implied is that in order to maintain social distancing for your workforce, you got to train everyone on how you're going to do that. You can't just say, hey, everyone, we're going to be social distancing. You need to create some sort of guidelines on, hey, this is how we're going to do social distancing for our particular workforce.
Very good. Thanks. Anything else, guys, in question 3?
I think that's it.
Yeah, okay. I don't have anything either.
All right, question 4, health and safety again. How can I screen employees for COVID-19 when they return to the workplace?
So this is a great question because a lot of the reopening rules that I've seen from states and local jurisdictions require you to put into place some sort of screening procedure. Now, typically under the ADA, medical examinations of your employees are not permitted. However, because of the direct threat posed by the pandemic, the EEOC has made an exception to this rule under the ADA. They've explicitly said that employers can use COVID-19 testing, so the direct swab testing, and temperature checks. I've boiled down screening into 3 different methods, and whichever one you want to pick is going to depend on the particular exposure of risk in your workplace. So the most stringent method, for me at least, I think is the COVID-19 testing. Again, this is permitted under the ADA, but it has certain limitations for how you can do this. You need to make sure that if you are doing COVID-19 testing, that it is accurate and reliable. I would recommend if you're looking into potentially performing COVID-19 testing for your workplace, and now this is an extreme example of screening, but if you do want to do this, I would go ahead and check out CDC guidance on, okay, what exactly is accurate and reliable testing. Be sure that when you are using COVID-19 testing, that you're using it consistently. What I mean by that is that you aren't singling out certain members of your organization for testing and you're not testing others. Now, if you're doing COVID-19 testing based on some sort of objective standard, so for example, you're only testing members of a particular department because they are interacting with the public, that's fine, just so long as you don't single individual people out, because that would give rise to a possible discrimination claim. And then if you do COVID-19 testing, you need to be prepared for what you're going to do if employees refuse to get tested. If I had an employee who said, I do not want to be tested for COVID-19, I would ask them, why are you concerned, and see if they bring up anything that could be protected under the law. For example, some sort of religious objection or an objection based on a medical condition. Now, the second method of screening employees would be temperature checks. It's similar to COVID-19 testing, where it needs to be accurate, reliable. You need to use it consistently among your workplace. And I would say a word of caution with temperature checks, that, you know, as we know, there's a lot of people who aren't showing symptoms for coronavirus, but still have the virus. So this isn't a fail-proof method for examining your workplace. The third method, which I think is, if you have a certain workforce where, let's say you're in an office, there's not a lot of new people coming in, I would use this method. It's a screening questionnaire. So you would basically give your employees a survey, and you can decide how frequently you want to hand it out, asking whether they have COVID-19 symptoms. Make sure that if you're using any of these methods, that you keep them all, any records, confidential and in a separate medical file. But that's, in a nutshell, 3 different ways you can screen employees for COVID-19 when you're reopening the workplace.
Hey, Nicole, let me give you a specific scenario. So what I talked to an employer a few weeks ago, this whole thing was coming out, and they had a couple employees approach saying, hey, can you go please send so-and-so home? They've been sneezing a lot. And it was the opinion of this employer that the complaint was it was greatly exaggerated, but they were very concerned about, okay, I have complaints. I think they're wrong. It's sneezing, not coughing. There's a million other reasons, personalities and whatnot involved. You know, how do they approach that? Because they were concerned about approaching what in their mind was a very good employee who happened to sneeze a couple times and triggered some people.
Sure, and that's a great question. That's sort of it's a tricky issue, because you want to balance out, you know, these employees' concerns for their own health and safety against, you know, the rights of this employee who sneezed a couple of times. What I would do is I always, as an attorney, go back to what is the objective facts that we need to look at here, which is I would go ahead and take a look at the CDC website and look at the symptoms listed for coronavirus. I believe the most recent guidance says that if you have coughing or a fever, you could have coronavirus. And then there's a separate column that says if you have at least 2 of these symptoms, you could have coronavirus. And on that list is sneezing, but there's also, you need to have another symptom coupled with that. So what I would do is I would approach the employee who potentially, you know, is showing symptoms. I would isolate them into a private room just in case they do have coronavirus. And I might talk to them, maybe if there is a serious concern they have coronavirus, I might talk to them over the phone or electronically. But I would ask them, you know, I would say, it's come to my attention that, you know, you may have been sneezing. You know, I want to make sure that we have a safe workplace. Have you been experiencing any other of these symptoms? And I would list all of the symptoms for coronavirus. And if the employee says, yes, I'm experiencing one other symptom, the most cautious advice would be, unfortunately, to send that person home. Now, if the person says, no, look, I got hay fever, I'm allergic to things, you know, that's why I'm sneezing, I'm not experiencing any other symptoms, I would go ahead and circle back with those employees who made the complaint and let them know, I looked into this. This person has reported they're experiencing no other symptoms consistent with coronavirus. And I want to let you know, these are all of the other ways that we are making sure we're maintaining a healthy and safe working environment for you.
Hey, Nicole, and maybe either you or Mark respond to this. So you guys have made references a few times already. And as we talk about the 10 questions we're going to address, I know this is going to come up again. We made reference to checking CDC site, right? So I know that I have to follow the laws passed by my city, by my county, by my state, by my federal government. But the CDC is not a legislative body, right? So they provide guidance, not laws, right? So what is the importance, and what is in a legal context? What's the importance of employers referencing sources like the CDC and the local health department to make their plans in how best to act?
Sure. I mean, the best way I can sum it up is that you're receiving the most current expert advice on what's going on by paying attention to these public health authorities. By basing any decisions off of the CDC or some sort of local public health authority, you're saying, look, I'm not making any assumptions here. This is based on what the top experts are saying on the current state of this virus.
So at the end of the day, not to suggest it's not a really wise thing to do anyway, right? That's certainly the guidance we would give. But while it may not be a legal requirement, it is certainly good risk mitigation, if not wise practice to make those references. Is that a good way of saying it?
Definitely.
Yeah.
Yeah,
Okay.
it's guidance, and I will. A lot of times I will see within a mandated law reference to the CDC. So there is a ton of intersection there, but no, the CDC does not issue laws that you're required to follow.
Right. Okay, very good. Anything else on question 4, guys?
I think that's it.
All right, let's go to question 5. All right, so I jumped the shark a little bit on this last one, didn't I? So how do we handle a suspected or confirmed case of COVID in the workplace? I guess the last one wasn't even suspected; it was the complaint thereof. But let's advance that topic one step further, I guess.
Sure. So the first thing you want to do is isolate whoever has the COVID-19 symptoms. One way to prepare for some sort of outbreak in your workforce is to determine, okay, if there is someone who's showing symptoms, what room are we going to use to isolate them? I would recommend contacting your local health department for next steps, especially if this seems to be some sort of an emergency. Of course, dial 911 if there's a serious emergency. I would interview the employee remotely to determine exposure. And what I mean by that is talking to the employee and saying, who have you interacted with in our workforce, or which, clients, vendors, or, members of the public, who have you interacted with for the past, week or so to determine possible exposure, and then also finding out physically where has the employee been working to determine exposure. So if they say, I've been in this conference room and this conference room and my cubicle, you're going to know that, and this is the next step, you're going to need to close down those areas and deep clean them to protect the rest of your workforce. I would recommend notifying other employees who have been exposed to coronavirus that, hey, look, we have an employee who is showing symptoms. This is a suspected, or if it's a confirmed case, and then possibly telling those employees who have been exposed to go ahead and stay home for 2 weeks, just in case that they themselves have coronavirus. Make sure that when you're notifying other employees about the coronavirus case, that you're maintaining confidentiality of the employee who is sick, because that's required under the ADA. But those are the steps I would take in a nutshell.
Very good. Anything, Mark?
Yeah, so one of the places where this will really pop up and it could get complicated in a hurry is if you have outside salespeople or people in your workforce that visit clients and they're going from one client to another client to another client throughout the day. All of a sudden they come down with COVID-19. There is a ton of stuff that you're going to need to do and think about. How am I going to notify not only my own employees, but what am I going to say to my customers where this person has been? So that's where these legal considerations really come in. You have to keep it confidential, but you also have to talk to your potentially your customers and your vendors and whatnot. So if you got a sales force that is out and about, think about how you're going to think about that reporting structure if something does, heaven forbid, come up. So Nicole, do you have any other comments about that one?
Yeah, something you said reminded me in terms of whether or not this is legally required. If you do have a reopening plan from your governor and it says that you need to have an exposure risk plan in place, this is typically what it's referring to. It's sort of, do you have a plan in place in case someone comes down with coronavirus in your workplace? And then in terms of possible liability, for not having an exposure risk plan, you could, if you don't have anything in place and it's required by your governor, you could be in violation of that order. And then additionally, if you have a situation where someone comes down with coronavirus and you knew about it or you should have known about it and it was spread throughout the office, and worst case scenario, if someone potentially passes away, you could be on the hook for liability of not providing a safe workplace.
Very good. Thanks, guys. All right, let's go to question number 6. Health and safety, still on this topic. What type of social distancing, personal protection equipment, and physical barrier policies should employers be considering?
Sure. So the requirements here are going to depend on, of course, your jurisdiction, whatever your governor or your mayor is saying, and those requirements there. But generally, what I've seen is that the 6-foot social distancing mandate has been required by a lot of different states, and where social distancing is not possible, public health officials are recommending that you install barriers. So, for example, if someone is a cashier, it's not always possible to maintain the 6 feet distance, and so a lot of people have been installing plastic barriers. In terms of face masks, it's the same sort of rule. If someone is facing the public or they have some sort of direct interaction with a lot of different people, face masks are generally recommended, but it's going to depend on your particular jurisdiction that you're in. Now, there's a lot of different ways to maintain social distancing, and so I'll let Mark explain a little bit about that.
There's a ton of things that you can do here. Thanks, Nicole. That's awesome. Staggering your work schedules. So let's say you have the ability to say, okay, I'm going to have half my group show up from whatever time to whatever time, half the group show up whenever to whenever. Where people tend to congregate, think about this, is in the break room for lunches. Okay, so hey guys, we need to stagger our lunches. Staggering your desks or moving your workstations further apart. So if you have that ability to do that, I would definitely consider doing that. Maybe use every other cubicle if that's an option to you. Or you can, again, move people to other sides of the room, whatever the case may be. Gatherings or meetings. Typically, companies have staff meetings. Okay, how am I going to do this going forward? Can I have everybody just meet out in the parking lot? Why not? That's a possibility. It may look a little strange, but you know what? What the heck? On a nice day? Great. Or can I do this electronically? Can I do a go-to meeting with everybody at their desk? That's another option for you. Reducing the number of workstations in use at a given time. Virtual online meetings, text messaging instead of in-person meetings. Setting up rooms to facilitate appropriate distancing. For example, providing a limited number of chairs. Hey, I'm going to put 4 chairs in this room. We're all going to sit in each corner, and we're going to talk about whatever. Room capacities. Some facilities have large rooms that they can meet in. Some have tiny rooms. Okay. Hey, you see this in the stores now going on all the time. Oh, you can only have so many people per square foot in your store. Okay. Same thing applies here. In-person meetings, no more than 10, for instance, maybe is one of the phases that I've been seeing where, hey, on phase 2, phase 3, we're going to allow meetings, but no more than 10 attendees. Using dividers, floor markings to distinguish appropriate spacing for people waiting in lines or in front of service counters. You see that in the stores. You'll see a marking on the floor every 6 feet. Please do not get any closer than this. Controlling the number of people entering your building or office. So who's going to be responsible for that? Do you want your receptionist, your front desk person, are you going to give them the authority to say, hold on here, we got 16 people walking at the same time? No, hold on, only one or two at a time. And that's going to cause some, if you've got customers that come in a lot, they may be a little miffed by that, but understand that this is due to what's going on. So you have to think about how is that front desk person going to message that to those visitors. Hey, I'm sorry, we've reached our capacity for visitors at this moment. Please wait here, and as soon as we can, we'll get you seen, whatever the case may be. Physical distance monitor, similar to a safety monitor, to ensure social distancing practices are consistently followed. That goes back to that COVID-19 coordinator position. How is this working? And evaluate that. Have that person monitor the workplace. Okay, how is that working between that group over there versus this group over here? Oh, look, they're spending a lot of time too close together. There's 15 people there. Hold on, we got to figure out something here. Outdoor work areas or mobile work areas. Have workers take separate vehicles when passenger space in vans or trucks doesn't allow for social distancing. Will that add an extra expense? Potentially. Instead of taking one truck to a work site, you may have to take 2 or 3. Reducing your in-person visits with clients or customers. Rely on email, text, online meetings. Right now, a lot of workplaces are like, hey, this is okay for now. However, I do want some person-to-person, face-to-face time, and I'm going to ask you to come on site. Okay, what's your response to that request from a customer going to be? Prearrange with clients and customers drop-off pickup packages. Vendors are doing this all the time. You see restaurants doing this. Yeah, there's a ton of stuff going on there with that. Contact your clients to inquire about COVID-19 symptoms before making a house visit. So this is where I goes back to that outside sales force or people who are going out servicing clients' accounts. Hey, tell me about your precautions in your workplace. That could, if you've got a lot of customers, that's going to take some time to do that. What does my workforce who's going out to these sites need? Do they need gloves? Do they need masks? Whatever, face shields, whatever the case may be. Outdoor work and break areas accommodate social distancing. Shaded break areas are large enough to allow a minimum distance of 6 feet between workers. You know, if you've got that ability to do that and it's a nice day, I think people would appreciate that. There is a ton of things that you can think about. It may be outside of the norm, but then again, we're outside of the norm right now as it is. So be creative. And one of the benefits of this from an HR standpoint, it may actually help to enhance your work environment amongst your workers.
All right, Mark, I'm looking at the clock here and I know we got about 15 minutes to get through last
Okay.
4, so we're probably going to accelerate. Anything else, Mark or Nicole, on question 6?
Nope.
Okay. All right, 7, hiring and onboarding. Change gears here a little bit. How do you bring, and maybe all caps should be the word, everyone. How do we bring everyone back? Because sometimes it can happen all at once and a whole bunch of times it can't.
Right. So how you will reopen goes back to that original question. Are we going to do it slowly or with everybody or a few staff at a time? Who do I bring back first? Hiring new employees. Where do I look? Where am I going to get them from? There's going to be a ton of people out there looking for work. This may be a great chance that if you've got employees who aren't coming back, to hire great talent out there. Updating your I-9s, right? Talked about W-4s, background drug testing. If your DOT requirements is one, if you got a lot of truckers, CDLs, things like that, you have to look into that. Benefits, restarting benefits. How am I going to do that? Communication with employees at work now and communication with employees who will be coming back that have been furloughed or laid off. What do I need to think about when interviewing post-19 closure? What questions can I ask a candidate? What have been your travel activities? Things like that. Again, there's a lot of guidance out there. You've heard us reference it all the time. CDC, OSHA. Can you ask about where have you been the last 2 weeks? Have you traveled to wherever? So those are things to think about. Put them in place and train your managers on those things.
All right, very good. Anything else, Nicole?
No, Mark did a great job summarizing that.
Very good. Okay, question 8. What if an employee does not want to return? And boy, there's so many flavors of this, right? From personally talk to small business owners who are really struggling with this, ranging from their employees making more on unemployment than they did in their job, thanks to the $600 a weekly stipend from the government on top of their normal UI. And some employees were just legitimately concerned, and they think their local area is opening too early.
The first thing to ask is why. What is your concern? And see what it is. It could be any number of things. And then communicate your safety plan, what you're going to do, how you're going to do it. We've talked about that throughout the presentation. Do you need to give them every detail? No. However, you say, hey, we're taking these steps to ensure your safety, and I encourage you to do it. Now, Nicole's going to talk a little bit more about some of the things to take into consideration when you ask that question, because that could be a loaded question. You may find out some things you don't need to find out or don't want to find out. So again, asking them why, what's the concerns, and see where that conversation goes. And that can go a number of different ways. And you may need to say, you know what, I need to ask my HR person about whatever aspect that was just brought up, just to be sure, and just to make sure that I answer your question completely.
Mm-hmm. So going off of that, when you do ask someone, what are your concerns with returning, the ADA forbids employers from directly asking employees anything that would elicit information about a disability. And so in other words, when you ask that question, you do need to phrase it in a sort of a general terms. You can't directly ask, do you have an underlying medical condition, and is that the reason why you're scared to return? When they respond to you, make sure that if the person brings up something that could be protected under the law, that you are taking that seriously and taking whatever steps you need, depending on the reason why they're scared. So, for example, let's say you ask a person, why are you concerned? And they say, I do have this underlying medical condition, and I'm worried about complications if I contract this virus. In that case, you're going to need to go down the ADA interactive process route and determine if there's some sort of reasonable accommodation for the person that would allow them to continue performing their job. More often than not, this is going to be telecommuting if exposure is the issue. Another thing that could be protected that they bring up is they say, look, I'm sick, or I'm caring for my family that's sick. That could be protected under both the new Emergency Paid Sick Leave Act, as well as if you have a specific state leave program that allows for paid sick leave, as well as if they're caring for a family member, it could potentially be protected under FMLA if you have some sort of state leave program that's in place that would protect them. Or if they're caring for their son or daughter whose school is closed, it could be protected under the new Emergency Family Medical Leave. One last thing, you need to check your particular jurisdiction for other types of protected groups. So, for example, Washington has put into place a mandate from the governor that if an employee is over 65 years of age or has an underlying medical condition, that employers need to make feasible modifications to work. So be aware that there could be state-specific requirements related to COVID-19 exposure. Now, in terms of things that aren't protected, if someone is scared and there's no sort of medical reason for being scared, they're just they just say, I don't want to return, and there's no, I don't belong to a high-risk category. Then in those cases, you do not need to follow any particular law, but how you want to handle it is going to be dependent on sort of the HR practices that you want to uphold. So you could say, look, I want my employees to feel safe, so I'm going to allow this person to take an unpaid leave of absence. Or if you want to take, potentially a more stringent route, you could say, look, I'm going to hold you to our attendance policy, and if you don't come in when you're scheduled, then I'm going to discipline you for that.
Nicole, maybe I'm going to push you in an area maybe you're even a little uncomfortable to go, because I know this is not a tying to PPP loans and forgiveness and whatnot, but I've had maybe a dozen conversations with small business employers who are really wrestling with this. Good human beings who want to do right by employees and don't force them to come back until they're comfortable. Their heart's desire is to really honor the employees' wishes. At the same time, they're trying to survive in their business, and the PPP dollars run out, after the 8-week clock. And if they don't get spent, they don't get forgiven. What can you give some guidance for an employer who, how much can they should they versus legally can they play hardball, saying, okay, well, if you're not going to come back, unemployment's going to go away, or okay, if you're not going to come back, you're refusing work, I'm going to have to find an alternate employee. Not that these people even want to do that, but a lot of people feel like their backs are up against the wall. What kind of guidance can you give there?
Sure. So I wouldn't say for certain to an employee who you're not allowing to, if an employee refuses to come back to work, I wouldn't sort of, for lack of a better word, threaten them and say you're not going to be able to receive unemployment, because our unemployment systems have, there's been a huge number of changes to how they're being handled. And so it might be a case-by-case basis situation where the person could potentially be entitled to unemployment. So for example, in Washington, we've seen our unemployment system expand where an employee who refuses work may still be entitled to unemployment if the reason that they refuse work is related to COVID-19. So I would be aware of that. If someone refuses to return and there's no sort of protection there, you could say to the person, okay, well, we need to find some sort of replacement and potentially terminate the employee. But be careful when you do so. Make sure that if you do take that route, you are adhering to all of the health and safety requirements of your state. Because if someone is fired and they made some sort of complaint relating to the health and safety in their workplace and you weren't following the requirements, you could be in hot water for that.
And let me ask this: Are they even? It sounds like semantics, but I think in a legal context and liability, it matters. If the shelter order lifts, business reopens, and the person does not want to come back, they may not be using the words refuse. It's probably unlikely even a confrontational conversation, and probably pretty friendly, but hey, I'm just not comfortable coming back. Is it in fact even terminating that person, or is it them quitting?
Oh, that's a great question. If someone, I think that would be a resignation if someone is refusing to return and the job has been open to them. Yes, so I wouldn't call that a termination.
Yeah, I don't think for the most part these are confrontational things. These are good humans trying to do the right thing, but complex times. So the words matter, and I think that one is probably an important one. I know I've personally talked to employers with that specific question, so thank you very much. Okay, last couple. Let's go to question 9, and hopefully we can still have time to get maybe one or two from the audience here. So wage and hour question: what employee compensation and scheduling issues should I be considering during the reopening?
Okay, so there's a couple of things here. Any missed annual pay increases, for instance, if your review cycle, your pay review cycle happens to be falling at this time of year, think about, okay, are we going to adjust pay? Are we going to forego pay increases? Are there going to be pay cuts? And if so, when are we going to look at revoking those or making those retroactive, making it good again retroactively? Is that a possibility? Those are things to think about. Reducing salaries for an exempt employee. Exempt employee are those who are typically known as salaried, not eligible for overtime. If you're going to change that status, you can't do it in the middle of a work week, because the FLSA, Fair Labor Standards Act, says an exempt employee is paid their entire salary for any work completed in a week. So if you're going to do that in midweek, you can't do that. It needs to be done the following pay period of the next week, whatever. And you need to communicate that to your employee the moment you make that decision, or soon thereafter, because it's coming to them. It's going to affect their pay. Pay is one of the most sensitive issues for employees, as we all know. Will hazard pay be offered or revoked? Depends on the position. Pay equity audits. Nicole sort of kind of got started down this as well. What groups, if I'm going to change pay for people, I need to look at, is this affecting a certain group of individuals? For instance, a minority, or women in the work group versus the men in the work group. Am I making the pay cuts? Am I using the same objective criteria across the board if I'm going to consider these pay cuts? So it's a good idea to look at that, saying, okay, I'm going to reduce pay for 25 people, and 20 of them are the women in the work group, and 5 are, you may want to think about that just a little bit more and think about your objective criteria. So there's some cautions there. Next slide. Or Nicole, you got anything to add to that?
No, you summarized it beautifully.
All right. Last question here. And our timing's about perfect. We're wrapping up the hour. So how should I handle employees who are prevented from working because of COVID-19?
So this question is framed broadly because I know that there's so many different reasons why someone says I can't come to work because of COVID-19. And so I want to review some of the reasons that are protected under the law and then some of them that are not protected under the law. This is going to cover federal law, and so you're going to also need to have to check your state and local law to see if any sort of additional protections could apply. So if you have a situation where an employee is sick, they could be entitled to emergency paid sick leave under the new FFCRA. But if they are sick with COVID-19 symptoms, in order to receive emergency paid sick leave, they also need to be actively seeking a diagnosis. The leave exists not only to help people who are sick, but also to give people time off in order to go to the doctor and get that diagnosis. Now, let's say you have a situation where someone does get a diagnosis and they are positive for COVID-19. In that case, the second, another reason for emergency paid sick leave could come into play, which is a healthcare provider advises the person to self-quarantine for a stated period. So if someone does receive a positive coronavirus test, they likely are going to be advised to quarantine, and emergency paid sick leave would apply in those situations. Now, let's say you have a situation where someone is high risk for COVID-19 complications. They've got an underlying medical condition, for example. The emergency paid sick leave could come into play in those situations if the person, like I said, is advised by their healthcare provider to self-quarantine. If someone does have an underlying medical condition, you may need to offer them time off as an accommodation under the ADA. Excuse me. Other reasons someone could potentially qualify for emergency paid sick leave is that they are caring for someone who is sick and seeking a diagnosis, or they're caring for someone who has been advised by a healthcare provider to self-quarantine. If someone is caring for their son or daughter because their school has been closed and there's no one else available to watch the kids, they could potentially qualify for both emergency paid sick leave and emergency family medical leave. Other reasons for potentially receiving protected time off could be that the person is pregnant and they've been advised to self-quarantine by their doctor, or maybe you have some sort of state law that provides leave for pregnant employees or accommodation for pregnant employees. If someone is over the age of 65, they additionally could be advised to quarantine by their medical provider. In terms of things that are not protected, as I said earlier, if someone is scared and there's no sort of underlying reason for their fear in returning back to work, you're not legally required to offer them that time off. Similarly, if someone is living with someone who is high risk, unless that person is being cared for by your employee, you don't need to offer them time off to reduce exposure. But if you do have a situation where someone's living with someone who is high risk for complications and they are providing care, they may be entitled to emergency paid sick leave. Now, you may want to consider if someone is living with someone who's high risk, that's something that's outside someone's control. And so you may want to offer that person some sort of flexible time off considering those circumstances. So if you haven't done so already, I would go ahead and set up some sort of policy for how your workplace is going to be handling emergency paid sick leave and family medical leave under the FFCRA, and how you're going to administer it in a way that ensures that you're going to receive tax credits for those leaves. And with that, I'll turn it back to Mike.
Yeah, Nicole, Mark, thanks so much. I know we're out of time here. We're at the end of the hour, and so we don't have time for Q&A. Lots of good questions came in, but I think we just covered a ton of really important information. I think it was more important that we did a deep dive on those top 10 and not shortchange any of those topics, because those are the things that every one of us is going to be facing as our businesses reopen. So real quick, I want to let you guys know next week's webinar. So same time, same place, Thursday, 1 o'clock Central Time. We're gonna do a deeper analysis on the tax credits and deferrals that are available to employers through FFCRA and CARES, employer retention credits, employee tax credits, and for those who did not get or elected to give back PPP dollars, tax deferment opportunities. So I would say it's very, very important, big financial impact for companies, but it has been far less advertised than the EIDL and PPP monies for fairly obvious reasons. People needed cash. Those are big stimulus programs that people jumped on. But now, we're getting into the finer grains here, and there are still really big opportunities left for employers. But this, admittedly, as soon as you start talking tax, this gets more complex. So we're going to have an expert on next week that addresses that exact issue. And with that, always come to our website, suresoftware.com, COVID-19, tons of great resources. Last week's webinar was hugely attended, Maximize Your PPP Loan Forgiveness, a lot of great information there. COVID-19 Survival Guide for Small Businesses. And if you're in the market, there's some really tremendous offers for literally free HR services for a 90-day period to help people get the HR advice and consultation from experts, just like you heard from today, through this period without a contractual obligation to stay on with Assure. If you're happy with it, we'd love to partner with you, but at minimum, a 90-day HR resource for you, as well as some pretty aggressive opportunity to enjoy our payroll service, of which includes reports built in for the CARES PPP to either help you apply for and get your PPP financing, maybe more importantly at this point, since most people have already applied, is to maximize your reimbursement. So you actually have the reports to prove that you paid what you said you paid to maximize the forgiveness portion of the loans. So with that, unfortunately, we're out of time. I just want to thank everybody for attending, and we look forward to seeing you next week.
Thank you.
Thank you.